All right, now to a story we've been following for months. The U.S. is having its worst year for the measles outbreak in more than 30 years, with almost 1,300 cases in 39 states across the country. The Centers for Disease Control and Prevention says the status of measles being an eliminated disease could be removed if the spread continues this year. So why is this treatable and very preventable disease making a comeback? Joining us now to talk more about this is Dr. William Schaffner, professor of medicine and infectious disease at Vanderbilt University. And thank you so much for joining us here this morning on Scripps News.
Hello, Holly. Good to be with you.
So, we know that Texas was the epicenter of the outbreak. The number of cases are declining there, but now we're seeing an uptick in other states like Missouri. So as this disease moves around the country, are we at risk of growing those numbers every month and then by default every year?
Well, at the moment, this virus is spreading, as you said, in a number of different places across the country. It's affecting groups of children who've been withheld from vaccination. And this most contagious virus is taking advantage of that. It's spreading to all of these unvaccinated children, and it could continue to do that. And if it continues for more than a year, we will lose our status as having eliminated measles in the United States, which would be a great, unfortunate event, because we were the first to eliminate measles back in 2000. We had no cases. And then measles has come back. We showed the rest of the world how to do it. And if we falter, that will not only reflect poorly on us, but will discourage other countries around the world who are trying to push measles vaccination.
Dr. Schaffner, I want to listen to something briefly with you from one of the doctors credited with eliminating the measles back in 2000. I want you to hear what he said around that time.
It really is made more difficult when you don't have an intact public health system, when you don't have a population that believes in evidence-based science, and is racked with concerns about conspiracy, and you have people who basically profiteer off misinformation.
Okay, so having heard that, he could have said that today. You talk about perhaps sliding backwards, being taken off the list of countries who have eliminated the disease. What do we do then to stop this backward slide that we're going through?
Well, we can do our best to try to make parents comfortable and reassured that vaccinating their children is the best, not only for their individual children, but for their communities. We want to make entire communities safe. You know, there are children living among us today who are immune compromised. They can't take the vaccine. And how do we protect them? Should they get infected with the measles virus, they would get seriously ill. We protect them by having everyone else around them vaccinated so the virus can't get through us to them. We have a responsibility to ourselves, to our own children, but we also have a responsibility to make our community safe. And we have to try to make parents comfortable and reassured that that is an important thing for them to do.
And we know that HHS Secretary Robert F. Kennedy Jr. has recommended the vaccine for measles. So why do you think parents are resistant? And as you say, we have to make them comfortable. How do we do that?
I think we can be persistent, reach out to them, ask them to speak to their local doctors who are there each and every day, every week, every month, taking care of their children when they're sick. Ask those doctors, get advice from them, and then follow that advice.
How do you think, overall we could shift thinking to more science and evidence-based action? Or do you think it's impossible to do that? Or is there a path to get people to understand? Because it can be intimidating. We look at our doctors and they are so brilliant, they're so smart, there's so much they know. It seems overwhelming for some of us.
Well, Holly, I'm an optimist, and I think We doctors have to listen to our patients, take the time to answer their questions, respond, and then provide reassurance that vaccination is important. You know, as I like to say, disease is bad, vaccination good.
And I like that you're an optimist. I am as well. But, you know, even thinking about this, though, are you concerned this could be a slippery slope, that maybe we might see more diseases we already have eliminated again start to make a reoccurrence?
Oh, there's no doubt about that, Holly. I am concerned. Measles is the tip of the spear. It is so transmissible, so communicable, so contagious that it's the first of the vaccine preventable diseases that will return. But there are others that could come along, polio, for example, and diphtheria and other kinds of illnesses that we haven't seen in this country for years and years. There could be a resurgence of those diseases. We don't want to turn back the clock. These are incredible public health advances. Vaccines have eliminated disparities in childhood, disparities by race, by income, rural, urban location. We have provided vaccines for all of our children. We should not withdraw from that.
All right, Dr. William Schaffner, always great to have you on, get your perspective and hear about your optimism. We love it. We hope it's infectious, the optimism. Thank you so much for being here.